Hey gang, must be Wednesday. This is Mark Sweeney here at Austin Dental Spa. If you've tuned in to Wednesdays before, we always shoot a Facebook Live on Wednesdays about this time with scientific information. Today's going to be no different. We've got some stuff that's hot off the presses. And then I give a health tip at the end. We try to have a little fun doing that. If you're here for the first time, that's kind of the format. If you're a return visitor, welcome back. And we're into September now. As you know, we always have a different theme. This one I don't think we've used before, but I'm surprised that we haven't. It's a September to remember. So we're going to give you all kinds of hot tips and topics for the next 4 weeks that you can hopefully put to use right away. That'll make your life better, make your life healthier, make everything better in your world, and give yourself a September to remember. Next week is the big gala from the American Statesman next Wednesday, so we won't be doing Wisdom Wednesday next week, so we'll skip a week. Hopefully the week after I'll be able to announce that we won one of the 2 categories that we are finalists in, Best Dentist in Austin and Best Cosmetic Dentist Practice in Austin. And my intent is to win both of them, but it's not totally up to me. It was up to you voters. Thank you out there if you voted every day during the voting periods. And now we've had to wait 2 months to find out, but next Wednesday we will find out, and then it gets posted all over the place in the American Statesman because it was kind of their sponsored program. Today, before we get to the scientific topic, I use the term hot off the presses. Do you know where that term comes from? Well, back in the dark ages when printing presses first started, I think late 1800s, early 1900s, they actually had to carve the little letters out of wood. And they would keep them in a big collection because a lot of letters get used multiple times. And they would actually have to hand set those little wooden letters into a template, and then they would dip it in ink, and then under heat, they would press it onto the paper such as it was at the time. So it was hot when it first came off, but that's what got the ink to set into the paper. And so hot off the presses referred to the fact that if they pressed it down and you got a paper that was still warm to the touch, you were getting it hot off the presses, which is about as recent of a news as you could get back in the late 1800s. So Benjamin Franklin is generally credited as being one of the inventors of the very first printing press, where they could just mass produce newspapers by heating up the ink, heating up the press, and then pressing it onto the paper. So there's your little trivia for the day. Now, what are we going to talk about today? You know, if you could take a simple saliva test and tell whether you might be a candidate for heart disease, would that be something of interest to you? Of course it would. Actually, we've got a patient who has a business here in Austin that is studying saliva tests for cancer, for the ulcerative colitis, for diabetes, for what we're going to talk about today, heart disease, for gum disease. They already have a saliva test that you can do that will show what kind of bacteria you have in your mouth that might lead you more towards being a candidate for gum disease. But today, we're going to talk about heart disease and the relationship between the mouth and the heart, which we've known for over 20 years, that there is direct correlation between what's going on in your mouth, mainly due to inflammation. If you've got gum disease, then you've got inflammation of your gum tissue, and that doesn't just stay in your mouth. 45 years ago in dental school, they taught us that everything they're teaching us for 4 years in dental school stops right here. It doesn't go every place else. Well, we know that's total BS now, that it gets into your bloodstream, it goes everywhere. And so if you've got a chronic inflammatory area in your body, whether it's in your ulcerative colitis area, on the skin on the outside of your body, or in your mouth, then it's affecting your immune system all through your body. And so these scientists came up with a saliva test, and I'll tell you specifics about the study in a minute, but this just came out. It is definitely hot off the presses. It just came out last month. So the research team used a oral rinse. They took people 28 people between the ages of 18 and 30. So these are young people who had no history of heart disease, no history of gum disease, and no comorbidities. It's been a while since you've heard that term, huh? And so they were asked to fast for 6 hours before they came in, which means they didn't eat anything. They could only drink water. And then they came in and they had to rinse their mouth with water. And then they rinsed their mouth with saline, which is a salty water. That's what they put in IVs when you get admitted to the hospital to rehydrate you intravenously. Then they had to take a couple of tests, and an electrocardiogram, which measures the electrical activity of your heart. That's the QRS pattern that you see on all the heart people. It's the real familiar one. Then they had to lay down for another 10 minutes, and they took their blood pressure and did a blood flow mediated dilation, which means they're looking at how hard the arteries are, how hard the blood is pushing through the arteries, and how elastic they were, how much they would stretch and rebound back. So they measured all these things on these 18 to 30-year-old people. And what they found out is that people who had a high white blood cell count in their mouth, which indicated that they might have a high degree of inflammation going on in their mouths, also tested poorly on those heart measurements that they were doing. The blood flow, the arteries were harder and didn't respond as well to the blood flowing through them, nor did they expand as well when the person had high white blood cell count in an otherwise normal, healthy looking person. Young also. What they found is that not only did it affect the blood flow levels, but that it affected the actual arterial movement, dilation. So that's something worth knowing about. These blood tests are going to become more available if they're already testing stuff like this. It's not but a matter of time before they come out with one that you can buy and check yourself at home. So in dentistry, we have a couple of different saliva tests for different things. For A1C, which is the protein in your body that elevates when you've got inflammation in your body. We're mainly looking at inflammation in the head and neck and the mouth area, but it does interest us because it affects your whole body. So keep a lookout for this. It's brand new, hot off the press, but it's something that you're going to see written about more and might even show up on Facebook and in Cosmopolitan magazine, the two medical journals that people pay most attention to. So my health tip for the week: have you ever considered the difference between mustard and mayonnaise? Well, mayonnaise is loaded with fat, and ketchup, as good as it tastes. I quit eating ketchup while we were in dental school because they showed us how much sugar is in ketchup. It's not total sugar, but it's about 50 to 60% sugar. And so every time you dip your fry in the ketchup and take a bite, you potentially are raising your glucose level in your blood, and your insulin level is going to go up. All those are in reaction to ingesting sugar. So mustard doesn't have those fats in it. And they've shown that eating a tablespoon or a teaspoon, actually much smaller, a teaspoon of mustard seeds can actually boost your metabolism for 3 to 4 months after you consume that. Just raw mustard seeds don't taste all that great. They taste like raw mustard. And lastly, mustard has the same type of antioxidants that broccoli has, that people are always promoting broccoli as being good for your heart and good for your body because of the antioxidants that fight the free radicals that go around in your body that are largely responsible for precancerous lesions. So try mustard instead of mayonnaise next time and see if it might make you feel a little bit healthier. And it just changes the taste some. I switch back and forth between the two. I like the real Hellmann's mayonnaise, but I use mustard pretty regularly too. So keep that in mind. Hope you have a great week. We won't see you next week as I discussed. We will see you in 2 weeks, hopefully with some new awards. See you then.